Following the ALK-positive IHC test, this patient was initiated on first-line therapy with alectinib. The patient experienced side effects including fatigue, constipation, and nausea. These are all relatively typical for alectinib. All of our tyrosine kinase inhibitors that are used to treat ALK-positive disease do have some side effects, but in general these are far better than most standard therapies such as chemotherapy. The FDA-approved options for first-line ALK inhibitor treatment in non-small cell lung cancer include crizotinib, ceritinib, and alectinib currently. Crizotinib was the first FDA-approved drug, later ceritinib, and then following that, alectinib. Here, I agree with the choice of alectinib as the first-line therapy. It's, I think, clearly the most beneficial therapy and the frontline therapy of the FDA-approved therapies. Crizotinib, we know, has an average PFS in the range of 10 to 12 months. Ceritinib in the range of 18 months, and alectinib has a PFS in the range of 2 to 3 years. And so we're really talking about a significant improvement. Now, ceritinib was never compared directly to crizotinib. It was only compared to chemotherapy, but again, using that kind of cross-trial comparison of progression-free survival, alectinib seems the better choice, and alectinib was compared directly to crizotinib and was far superior in terms of time to progression. Brigatinib is a potential new frontline option for patients with ALK-positive disease. It's not yet FDA approved, but it is recommended in the NCCN guidelines as a potential first-line therapy. Here again, we have a randomized trial, not of brigatinib versus alectinib, but brigatinib versus crizotinib. And although the first results that were presented were relatively early, we're seeing a very significant improvement in progression-free survival of brigatinib versus crizotinib, suggesting a similar magnitude of benefit. We don't really know what that magnitude will be compared to alectinib yet, but it was quite significant and I think represents another potential first-line option for patients who are diagnosed with ALK-positive lung adenocarcinoma.